I know. Good morning. Thank you all, the members and guests joining us today to talk about the importance of proper drug prescription disposal. Prescription drug abuse among Americans' teens has skyrocketed, making prescription drug abuse second only to marijuana among teens illegally using drugs. The Office of National Drug Control Policy estimates that nearly 1 in 5 teens admit to abusing prescription medications. Many teens report believing that prescription and over-the-counter drugs are safe to use and misuse. They also report believing that these drugs are not addictive. Because teens are naive to the dangers of prescription drug abuse, adolescents are more likely than young adults to become dependent on prescription medication. We are here today to warn the parents of the Commonwealth to not allow their own medicine cabinets to become the place where their child scores his or her next high. If you have prescription drugs that you're no longer using in your home, you'll have an opportunity to properly dispose of them Saturday, April 30th, during the Federal Drug Enforcement Administration's National Take Back Initiative. In September, the DA collected 121 tons of unused prescription drugs. On Saturday, there will be 4,700 drop-off sites nationwide for unwanted prescription and over-the-counter capsules and tablets. There will be several drop-off sites in central Pennsylvania and across Pennsylvania in general, including one I'm co-hosting with the West Manchester Police Department. I urge everyone to take advantage of a drop site in your area. Along with co-hosting a drop-off site in my area, I've sponsored a resolution to raise awareness of the need to properly dispose of these substances. In addition to serving a public health need, the initiative also will protect our environment. Years ago, people were told to flush their old prescriptions down the toilet. Now we know the dangers of these chemicals can pose to our waterways and wildlife. Proper drug disposal is vital to the health and safety of our communities, and I am proud to join the DEA, local law enforcement, other advocates, and my members here in the General Assembly in this initiative. Joining me today is West Manchester Township Police Arthur Smith, Northern Regional Police Chief Mark Bensel, Dave Stevens, criminal investigator from Northern Regional Police Department, Martha King, Board of Directors for the Awareness Group of Hanover, an advocacy organization for substance abuse, Mike Verb, Republican Secretary and law enforcement officer, an all-around good guy, Representative Karen Boback, true champion for children in the House. Great to have her here. And now I'd like to introduce Springsbury Township Chief of Police Dave Eschbach. Thanks, Dave, for coming.
Thank you. Good morning. This Saturday, April 30th, the DEA, in conjunction with state and local law enforcement, will conduct its second National Take Back Initiative, providing a unified opportunity for the public to surrender expired, unwanted, or unused pharmaceutical controlled substances. The substances collected will then be destroyed in a manner that ensures that they won't harm the environment or the community. Americans nationwide will have the opportunity to turn back prescription pharmaceuticals in a completely anonymous way at safe collection sites established by the DEA in collaboration with state and local law enforcement authorities, local business partners, and private organizations. Participants may turn back substances that are controlled by prescription and also medicines that are sold over the counter, to include Liquided or cream medications in their respective containers. Most folks don't realize the very real threat to public safety, public health, and personal well-being that the prescription drug abuse poses to American society. Approximately 7 million Americans currently abuse prescription medications, and every day, 2,500 teens abuse prescription drugs to get high for the first time, according to the Partnership for a Drug-Free America. This first-time experience with a prescription, non-controlled, and over-the-counter medication many times becomes the gateway for future illegal drug abuse of controlled substances such as marijuana, cocaine, heroin, LSD, etc. The most stunning fact about the abuse of prescription or over-the-counter medications is that the substances abused are usually obtained from family, friends, acquaintances, and seemingly harmless sources such as the home medicine cabinet. Use and abuse of prescription drugs for non-medical purposes ranks second only to marijuana use as the most common form of drug abuse in the United States. Most, if not all of us standing here today, whether or not we choose to admit it, know or at least are acquainted with a person, family member, co-worker, associate, or constituent who is or has at some time abused prescription or over-the-counter medications. Unused, unwanted, or expired prescription medications are most definitely a public safety issue, which have led to accidental poisoning of children, overdose, abuse, and uses for which the substance was not intended. The improper disposal of these substances, such as throwing them in your day-to-day trash or flushing them down the drain, can lead to environmental hazards and also the potential for the substances to again come into the hands of someone that will use them in an illicit manner. The second National Take Back Initiative gives law enforcement the unique opportunity to work together in a proactive manner to prevent drug crime in our communities. Someone who engages in criminal enterprise, regardless to what degree, needs three things to initiate and execute the illegal activity. One is the desire, two is the ability, and three is the opportunity. As a matter of fact, it is these three elements that compile the ingredients of any crime, from the most petty to the most felonious. Desire plus ability plus opportunity equal crime. There's not much we can do to change someone's wish or ability to commit a crime, but there is a lot that every member of our respective community can do to affect the opportunity that exists for a crime to be committed. And once the opportunity element of the equation is removed, the crime cannot and will not occur. Please help all those involved in the second National Take Back Initiative this Saturday, April 30th, in removing the opportunity to abuse unwanted, unused, or expired pharmaceutical and over-the-counter medications. Thank you.
Thanks, Chief. I'd also special thanks to Matt DeRullo from the Pennsylvania Pharmacists Association. We have full support of the pharmacists as they deal with this on an everyday basis as the professional drug dispensers of Pennsylvania. As my wife is a pharmacist, I hear all too many times the stories of drug abuse and leading to crime in order to forging prescriptions from docs and so forth. So I appreciate the Pharmacists Association support and thank you for being here. Our final speaker has experienced firsthand the danger and heartache that can result from prescription drug abuse. Phil Bauer is a constituent and an advocate for prescription drug safety. Phil, thank you for being here and sharing your story.
Good morning, everyone. My name is Phil Bauer, and I live in York County, and I'm here today speaking as a dad. First, I would like to thank Representative Grove for holding this press conference and for his House resolution. Prescription drug abuse is the fastest growing drug problem in the United States and is called a public health epidemic by the Centers for Disease Control and Prevention. Deaths related to misuse and abuse of prescription painkillers now cause more deaths in our country than heroin and cocaine combined. There's also been a 400% increase in those seeking addiction treatment related to prescription painkillers. This is a very personal issue with me. Our youngest son, Mark, died from prescription drugs, and his death was preventable and avoidable. A week prior to his high school graduation, Mark died on what would have been his last day of high school. That morning, we found him unresponsive in his bed. Cookie, my wife, called 911, and I started CPR. When emergency personnel arrived, we followed the ambulance to the hospital. Were escorted to the little room, and we heard the words that our son was dead. We went back to say our goodbyes, and we cried on him. And for Cookie and I, life as we knew it ended that day. Mark was quiet, respectful, athletic, and strong. Never much for words, he had a terrific sense of humor and could make me laugh just by his expressions and mannerisms. He loved sports, especially basketball, and was an avid weightlifter from the time he was 11. He actually played basketball and lifted weights on the day before he died. Besides sports, he loved his family, friends, the Outer Banks of North Carolina, puppies, Star Wars, and playing video games. One thing we will never know is why Mark chose to abuse prescription drugs. We don't know if he was abusing them to get high, to self-medicate, or to self-regulate. We also don't know if he had an addiction problem that went undetected, or if this was just an opportunity that presented itself. I now know that the abuse of medicine can lead to the same dependence and addiction as that of illicit drugs. They can also be lethal the first time, especially if mixed with other substances. 70% of all people who abuse prescriptions and over-the-counter medications get them from friends or relatives. I encourage all of you to make sure that medicines in your home are in your control at all times and get rid of unused, expired, or unneeded prescription drugs. There is no way to tell someone what it's like to lose a child. You either know what it's like or you don't, and I sincerely hope that you don't. I am committed to do all I can to help others avoid the devastation that Cookie and I live with every day. Thank you.
Thank you, Phil. I know with the leadership and the advocacy of Phil and Martha, the leadership in law enforcement from chiefs like Mark Bensel, Dave Eschbach, and Arthur Smith, and legislative leadership from Mike Verb and Karen Boback, I know we can bring this to the forefront and ensure we educate our children on the detriments of prescription drug abuse. Jan Jarrett from Penn Future was going to be here. Unfortunately, they moved up a Marcellus Shale Coalition meeting on her. She did want to advocate her support for ensuring we have clean water and ensuring prescription drugs don't end up in our water supply. With that, for those looking for drop-off sites, there are many throughout the Commonwealth. You can visit the DEA's website at justice.gov/DEA to access the list of drop-off sites. You can search by zip code and county on this website. Thank you all for joining us today, and remember to treat prescription and over-the-counter drugs in your home just as you would any dangerous substance. Thank you so much for being here. With that, any questions? Thank you very much.